Patellar tendinopathy or tendonitis, they're essentially the same thing, is an overload injury that affects the patella tendon, which is the thick tendon that's just below your knee and attaches your quad muscle onto your shin bone. Overload is a key aspect in all patella tendon cases. There's always a history of overload. Ask yourself, what have you done differently? This could be just a change in activity, taking up paddle or hiking or tennis or beginning a home exercise program. For athletes, it might be a more obvious spike in activity like ramping up running volume. It might not be blatant overload, but in those cases, it's often taking a break from activity and then returning to your normal activities. So even though you might have just been sick and not running for maybe 3 weeks, and then resuming normal running volume without ramping back up in that first week can be enough to irritate your patella tendon. Anyone can develop this condition, from busy moms and dads to high-level athletes. Activities and movements that use the quad muscle will also use the tendon. It's a very common condition in sports people where they're running and jumping and require a lot of high force, repeated contractions of your quad muscle. Like I mentioned, this happens for two main reasons. Number one is a sudden spike in activity, and number two is not allowing enough recovery time after high intensity training sessions. When we exercise and stress our bodies, our tissues like our muscles, bones, tendons sustain micro damage. The recovery time after training sessions is when we produce more cells to heal this damage and our bodies become stronger as a result. If you do another high intensity training session before your body is fully repaired, this micro damage can accumulate and you can develop an overload injury. Diagnosing patellar tendinopathy can be relatively straightforward. There's always some overloading issue in your story, and in testing, you will be more tender and sore pressing on the tendon. It's often pinpoint sore at the bottom of the kneecap, but it can also be down along the tendon. As well as point tenderness, the nature of the pain can be distinctive. In the early stages, it can be sore initially, but then improve as you warm up, only to get sorer again afterwards and the next day. If you ignore this condition, it might become too sore to continue with your sport. If your tendon is sore, daily activities like stairs and even walking can be sore. If it's not that sensitive, it might only hurt on higher intensity activities like squats, lunging, running or jumping. Again, if it's very sore, even sitting can annoy it as the tendon is in a stretched, bent leg position. Your recovery times again vary due to several factors, but how you manage this from the start is important. If you ignore it and let it become very sore, it can take longer than 6 months to recover. Commonly recommended options like shockwave therapy, anti-inflammatories, medications, PRP injections generally provide no benefit here. Some of these options can help with pain relief if added to a strengthening program. Massage and taping might also give some short-term relief. These are all just add-ons. 99% of this is a strengthening program. Steroid injections, while commonplace in healthcare, are advised against. They can mean that your tendon doesn't respond well to loading afterwards, and cortisone can predispose tendons to future tendon rupture. Surgery is only recommended when you have avoided aggravating activities and tried and failed 12 months of a consistent, tailored strengthening plan and seen no improvement. Recovering from patellar tendinopathy involves two main factors: relative rest instead of complete rest, and a structured strengthening program, a return to sport program. The evidence is very clear that this is the best approach. When it comes to the type of program and exercises, there are lots of options. Ideally, the program is tailored just for you, but all programs need to follow some basic principles. Number one, relative rest needs to be used. No program in the world is going to be effective if you just continue with the training intensities and conditions that contributed to your tendon getting irritated in the first place. Reduce the intensity of your training and daily activities to a level that doesn't irritate your knee. This might mean altering your work intensities if it's very sore, to avoid activities like kneeling on your knee and lots of stairs or deep squatting positions. This will allow you to make progress with your rehabilitation program, but it needs that rest. Number two, slight pain during exercise is okay. The program needs to progress over time. Some exercises are very suitable with a sore, sensitized tendon, but you would need very different exercises as your pain reduces and your tendon can tolerate more stress. Obviously, I'm advocating heavy strengthening exercises to fix this injury, but if you start with too much too soon, it can flare up your tendon pain. Exercises need to be challenging but doable, feeling the tendon slightly but not flaring it up. Getting this condition sorted involves putting high load through the tendon. An effective way of doing this is with heavy slow resistance. So in the gym, this would be holding the knee extension machine for 30 to 45 seconds per rep, or at home replicating this position as seen in the program I've provided. So the tendon is slightly lengthened and it's withstanding pressure from the contracting quad muscle. Isometric exercises like this, where you hold contraction, help to reduce pain, and exercises where the muscle lengthens and shortens, like squats and lunges, resemble the way our muscles and our tendons function as we move around. Plyometric exercises lower the tendon at speed and are vital if returning to sport. To fully recover from patellar tendonitis, you will also need to lift heavy things. You'll need gym access to achieve loads required here, and the exercise like low volume heavy deadlifts and squats can be used to improve the tendon's strength and also address other mechanical factors, strengthening other areas of your body that can contribute to overloading your knee. Doing these exercises through full range replaces the need to do extra mobility exercises, as these heavy exercises through full range will also improve your mobility. If you want to return to running or sport, I would also include running as part of your rehab process. Once pain is settled to very manageable levels and you have a base of strength built up in the gym, a gradual return to running program can begin with walk-run program, progressing on to returning to your sport, beginning with uncontested drills before increasing the volume and intensity. Here I've included a sample early, middle and late stage rehab program. I go into these exercises in more detail in this video here called the 10 best exercises to fix your patella tendon injury, where I give clear instructions on how to do them effectively, what you should feel during and after the exercise, how to make each exercise easier, more challenging, and the do's and don'ts regarding this injury and returning fully to running and playing your sport. If you like this video, please show your support by liking and subscribing and sharing these videos with people you know that are suffering with pain and injury and need some help. If you have any questions, please feel free to contact me by commenting below. Thanks.